And let's take a look at the latest numbers from the Oregon Health Authority. 540 new cases of COVID-19 reported today and one more death. That death puts our state past a grim milestone, more than 2,500 deaths. And tonight we're also learning that nearly half of the people who have died also suffered from heart disease. Our Fox 12's Bridget Chavez spoke with a cardiologist and asked some important questions.
Dr. Lindner tells me that the heart is essentially a target of COVID-19 and the virus attacks it in several different ways. If you have an underlying health condition like diabetes, a chronic illness, or several others, the CDC says you can be more likely to get severely sick from COVID-19. Of these many health factors, people with cardiovascular disease are dying at higher rates from the virus. According to the Oregon Health Authority, 49% of Oregonians who have died from COVID-19 also suffered from heart disease.
People who come into the emergency room with a heart attack, their overall mortality, if you do not have COVID, is less than 5% now. If you have a heart attack and it's related to COVID infection, your mortality rate is something more like 40 to 50%. It's tenfold higher.
Dr. Jonathan Lindner from OHSU says research is being done to explain why we're seeing higher death rates, and health experts are learning more each day.
It turns out that receptor that the spike protein binds to, that actually has some abnormal expression in people who have cardiovascular disease, which at least explains some of the story.
Lindner says if you already suffer from heart disease, not only are you more likely to get COVID-19, but also have severe complications.
When you develop some of the severe lung inflammatory conditions that really affect the lungs severely, the right side of the heart has to work extremely hard to get blood flow across the lungs, which is what's called right heart failure.
He says several other things can happen too, like a viral infection of the heart itself, inflammation that directly affects the heart and blood vessels, blood clots, and heart attacks.
We're seeing people who develop these little, what we call microvascular thromboses, thrombotic microangiopathy, which are clots inside of the smallest blood vessels of your organs. And that actually does damage not only to the heart, but to the brain and the kidney as well.
Lindner says that you can protect yourself through a healthy diet and exercise. And if you do have heart disease, he says it's important to make sure that you get vaccinated and follow all of the CDC's guidelines. Reporting from OHSU, Bridget Chavez, Fox 12 Oregon.